Is plantar fasciitis ruining your day? I'm Dr. James Randolph, physical therapist, and in this video, I'm going to show you my typical treatment approach for rehabilitating plantar fasciitis. I'll show you a combination of exercises and modalities that I perform in the physical therapy clinic when working with people who have this condition. But first, let's talk about how plantar fasciitis can present. This is typically characterized by pain in the bottom of the heel. One of the cardinal signs of plantar fasciitis is pain in the heel of the foot when first getting out of bed in the morning. People often describe it as a nail being driven in the bottom of the heel, and then after they start walking around for a bit, it tends to loosen up and not be as bad. Contributions to the development of plantar fasciitis can be loss of first toe extension mobility and loss of ankle dorsiflexion mobility, being able to bend the foot like this. This can put a lot of stress on the plantar fascia. Then the fascia tends to tighten up during the night, and hence that morning pain when getting out of bed in the morning. Sometimes a night splint may be prescribed, but this can be the proverbial cup of water being thrown onto a house fire. Now, when people present to physical therapy for this heel pain, and after doing a thorough evaluation, I typically start with an ultrasound treatment to the bottom of the foot, with the foot in a stretched position. Notice how I also incorporate a stretch to that first toe to improve extension mobility. This is to relieve that strain on the plantar fascia and start to loosen it up. Following the ultrasound, I go right into a soft tissue massage, again with the foot and toe in a stretched position. Some people may be really limited with this mobility, so we have to be careful stretching only to tolerance. Next, moving on to exercise, we start with a calf stretch to work on muscle flexibility and joint ankle mobility. We work on this for about 3 minutes, again stretching to tolerance. I find this calf board to be an amazing piece of equipment. Then, to enhance this stretch, we progress to knee bends on the calf board. This really puts a great stretch onto the plantar fascia, works on ankle joint mobility, and stretches that toe even more. We start with heels flat on the board, and as we go into a knee bend, we allow the heels to raise off the floor, then return to the starting position with heels down. And finally, we finish with some calf raises for further strengthening of the foot and ankle. Now, this may be only one approach for successful management of plantar fasciitis. However, this is my typical foundation for treatment before perhaps expanding into a more customized routine for each individual circumstance. Remember, if you have pain, you should consult with a healthcare provider to go over appropriate options. Thank you for watching. If you enjoyed this video, go ahead and hit that subscribe button and be sure to check out my YouTube channel for more tips on physical therapy, health, and wellness.